So in discussions with clinicians, when an opportunity exists for biosimilars, the question will come up: how much of this is driven by clinicians, how much of this is driven by regulatory agencies, and how much of these is driven by insurance providers as to whether or not we have that opportunity to select or use. While the studies have been done and the regulatory approvals have been offered to be able to extrapolate these results to different clinical settings, there are certain nuances which are, I think, going to be challenging, such as what if you were to look at combination strategy of looking at trastuzumab and pertuzumab? Can we use a biosimilar in combination with pertuzumab? We don't know. Most of the trials which have been done have looked at interim endpoints such as PCR rates or looking at response rate, progression-free survival in the metastatic setting. We don't have long-term data. So I think it's very critical that we have strong pharmacovigilance programs and also very strong naming programs so we can identify if there are toxicities in lieu of not having long-term data, so we can actually measure that prospectively and also make sure that we are using and measuring that in routine clinical practice. So I think these are some clinical challenges, some conundrums that we need to be prepared for as we incorporate biosimilars in routine practice.